Lori, first, I have to congratulate you on assuming your leadership role with SETRAC. It is so well deserved and not a surprise to anyone who is familiar with the role that you've played in preparedness, not just here in Houston and the state of Texas, but across the country. So congratulations first on that.
Thank you, Kelly.
So SETRAC, or Southeast Texas Regional Area Council, which is a mouthful, is such a unique model of collaboration. Can you start by explaining what it is and why it's so beneficial?
Sure. So SETRAC is a 501c3 nonprofit organization. We were founded back in the late 80s by Texas law to build trauma systems of care. So in order to do that, you have to bring competitors together in order to develop the protocols, the standards that are going to go into effect for a trauma service area, which is a geographical area identified by the state of Texas. So our mission is to be that neutral broker. We want to build a powerful coalition of providers, responders, and other healthcare related agencies to unite together to save lives, improve health outcomes. And we do this through research, through education, and through our collaboration.
Yeah, it's just so interesting to attend a SETRAC meeting and see all of these movers and shakers who in the marketplace are essentially competing with one another, collaborating at the same table. It really is exciting to see. Great segue into your annual conference that SETRAC hosts each year. I mean, it's really been a growing entity now for 14 years. So I'm interested in knowing how have you seen SETRAC's influence nationally on increasing awareness for preparedness and influencing those medical and first responder groups really across our nation?
So thank you for the plug on the symposium. We are quite pleased about how well it's grown. I mean, we started year one with 50 participants, and last year we were over 600.
Oh.
We've got folks that come from around the country, around the world. So we're pretty excited about that. And I think what sets it apart is that we pride ourselves in trying to get real world events that have occurred that also have a take-home lesson that the participants can actually write it down and institute it in their own coalitions or their own preparedness efforts.
So June, as you well know, is the beginning of hurricane season, not just here in Texas, but now in multiple states, and certainly along the Atlantic coast. We've also seen so many other natural disasters occurring throughout the country. I'm curious to know how you see the public's awareness for preparedness changed. Are we more preparedness aware?
So I think our residents are aware, but I do feel they're still unprepared. So Southeast Texas, we've seen a great influx of new residents to our area. They have no experience with our weather. They have no experience with our risks, with our petrochemical industry. So from street flooding that occurs on any given Tuesday, to a shelter-in-place order, to the random tornadoes that we're starting to see now, and of course our hurricanes. I think our new residents and some of our older residents that have been here, our original residents, have not really made personal preparedness a priority. I think some of the issue lies with us as emergency managers. I think our messaging needs to be improved. So similar to what you all did with the Together Against the Weather, those were real life vignettes that people could relate to. Right now, we've got a kind of a catchy little phrase that says, make a plan, build a kit. But what does that really mean to a family of 5 who has low income, that lives paycheck to paycheck and reliant upon public transportation to get around? What does that mean to them? I really think that our messaging needs to be more upfront with them, more transparent with them, who does this pertain to when we say make a plan, build a kit? Who does it pertain to? It pertains to you if you have any of the following situations. And these are the types of things that you need to be able to put into place to be self-sufficient for 5 to 7 days.
I know it's been frustrating for emergency management folks here who have seen like events happen in other communities that could have benefited from what was done here or learned here or things that worked here and could have put in place there, because there's a lot of times where if you're prepared for one event, it makes you prepared for others too. So are you seeing that reception across the country for what's worked in other locations to be a little bit more received?
So I think that it depends on where you're going. Some folks hear Texas and they don't want to hear anything about Texas, right? It's just the way it is. And then others they may be smaller states that don't have as many disasters. And so when I do speak with them, I say, I know what you're thinking in your head. You're thinking, well, we don't have tornadoes, we don't have hurricanes, we don't have this, we don't have that. And that's all fine and dandy for Houston to do. But you can take the lessons and you can take the basic framework and put that anywhere. And if you've got that basic framework, which is what we work from, it doesn't matter what the disaster is.
Right.
We've learned our lessons from other people.
Mm-hmm.
Our biggest lesson came out of Katrina on how to respond to hurricanes.
Yeah, no
we
kidding.
Learned from Rita, and
Yep.
we changed our processes, and we continue to change. Harvey it kind of like blew all of our plans out of the water. And so we had to go back and learn all of our lessons again,
Right.
and put those into place so that next time it doesn't happen again. So it's okay to fail, but if you fail repeatedly on the same issue, then you're not really learning anything.
I always tell people we can feel so much safer knowing who the leaders are sitting in the chairs making these things happen. And certainly you're one of those folks. So I appreciate you sharing some of your expertise, and good luck in the months ahead.
Thank you, Kelly.